Hey, what's going on, everyone? This is Drew back here at VCS 2017. I'm joined by Dr. Bootstaylor from Atlanta, right?
Yes.
And
absolutely.
you're a plastic surgeon?
I'm a plastic surgeon in Atlanta.
Great.
And practicing cosmetic surgery and breast surgery.
Cool. Well, thanks for joining us today. How's the show going so far for you?
It's a really good show. I was here last year,
Okay.
and last year I did more of the scientific shows.
Okay.
And then this year I did the practice management part of it. So
Cool.
I find it all encompassing. Has different specialties, so
Absolutely.
it's good.
Great. What are some of the, out of those sessions that you attended, what are some things that you learned that you're looking forward to kind of bring back to your practice to make it better?
Since I'm a surgeon, I spend most of my time operating, so I wanted to bring back more non-invasive procedures.
Okay.
And so some of the non-invasive procedures that I liked were things such as facial rejuvenation, where we're adding PRP, which is platelet-rich plasma,
Yep.
and peels and microneedling. So there's a lot of things for facial rejuvenation that would actually help my facelifts
Beautiful.
and my rhinoplasties. As far as skin resurfacing or tightening, there was a Thermi Tight,
Okay.
which has been around about 5 years or so.
Okay.
So I got a chance to drill down on
Cool.
some of their before and afters, and then just talking to people across all fields.
Great.
You know?
Yeah.
So that's nice.
That's what everybody's been telling me so far is the multi-specialty is really the big thing about this. So outside of Thermi, or do you have Thermi in your practice already?
I do have Thermi in my practice, and
Okay.
I added it because I wanted to have another tightening form.
Yeah.
That was non-invasive for clients, and then also I added a Thermiva because I do a lot of mommy makeovers, and
Okay.
I realized that was something that my patients were interested in.
Absolutely.
And they actually kind of told me about it, and once they start telling you to go get a machine,
Yeah, you're like, okay, I better get this
I
machine.
get the machine. So
Cool.
that was good. So
Was there anything, walking around the exhibit hall here and looking at other vendors and devices, is there anything else that piqued your interest that maybe you're thinking about, hey, I could use this?
There are tons of machines, and so I'm pretty methodical. I have to do the research first.
Right.
And then integrate it into my practice. Probably about 80% of my practice are people of color. So we have
Okay.
some differences in our scarring processes,
Sure.
our pigmentary processes. So when I'm at these meetings, I'm actually talking to other people who, may have a similar
Work
demographic.
with the same-
Yeah. So we're exchanging information.
Yeah.
So I travel about 2 times a year, sometime internationally if I need to, but I love what I do. I like
Cool.
traveling. I like learning this stuff all the time. So
Awesome.
This is what I do.
Beautiful. All right, let's shift gears a little bit. I'm going to ask you some personal questions
Sure.
to get to know you a little more. Nothing too serious.
All right.
What's your favorite color?
My favorite color is beige, actually.
Nice. Are you a sports fan?
Very much. Very competitive, yeah.
Nice. So did you play sports growing up? Do you play sports now? Or?
Tennis, and then also a track runner.
Okay, beautiful. What Atlanta sports team is your favorite?
Well, I'm from New York, from California.
Oh, so you don't go for Atlanta teams.
So I do
Maybe we should cut this. We don't want to.
Wait. I go for Atlanta 100%.
Okay.
However, my heart lies in different with
Gotcha.
different teams.
It's okay to like multiple
However,
teams.
the Falcons in our loss, I took it very hard.
Yeah.
I was very depressed, almost needed Prozac, but I'm okay now.
Are you a football fan then? Do you like football?
Not really.
Just-
I'm a runner,
Okay.
biker, kind of
Yeah.
individual sports.
Okay, cool. Right on. So why'd you get into plastic surgery?
Well, I was really good at art and also science. And coming from the family that I come from, a bunch of academicians, they were like, "You're not going to be an artist." So
You will
I
not be a
tried-
starving artist. You'll be a high-paying artist.
So I had to kind of drill down on what I was studying, and just
Okay.
plastic surgery was a natural fit for me.
So tell me more about this art then. So do you still do art outside of work?
Mostly, I would think things like photography,
Beautiful.
jewelry making.
Nice.
Those are the 2 main things.
A lot of
that I
creative
focus
hobbies.
on. Yeah.
Cool.
Yeah.
Awesome.
So that's it.
What were you like in high school?
I would think I went to Bronx Science. So I was a little bit of a nerd. So if someone were to put up my picture, they'd be like, "Oh my God!" But it's all good. I had a great time at that school, and I was just, very serious student. I was a great runner, or I don't want to say great runner, but I took it very seriously.
Yeah.
And then I took tennis pretty seriously.
Cool.
So
Nice.
that's probably where the competitive edge came in. But
Yeah,
it's all
nice.
good.
What do you love most about your job?
I love making the patients happy, basically, trying to find out, what could add value to their experience. And I want to make sure that I hit that mark first.
Yeah.
Because I just find if you fix the issue that they have, when they come in, they're always going to be happy in the end. And
Beautiful.
I don't try to oversell.
Yeah.
People in the end know their issues ultimately. I may see a ton of things, but I'm going to focus on that one thing that they don't have a problem with or don't like. And I'm always trying to kind of help patients feel better about them, feel better in their own skin. That's what I want them to feel after they've been in my practice. So
cool.
Nice. A lot of fun.
Yeah. All right, last question. If you can be any kind of animal, what animal would you be?
I'd be a panther.
Nice. How come?
Because it's kind of
beautiful
predatory,
creature.
It's beautiful, It's sleek, it has great lines, intelligent, and it sits back and it pounces.
I'm thinking of the panther in Jungle Book too. Is very intelligent, kind of like the mentor. I like it.
Yes,
cool. All right.
yes.
Well, thank you for joining us. I really appreciate it.
Thanks
for sharing your
me.
story.
All
Yeah.
right, great.
Have a good rest of your conference.
Same to you.
Okay.
Thanks for having me.
Yep.
Ooh.